In the 1990s, we took another great leap forward, if you will. DHCP was actually renamed Vista. Vista stands for the Veterans Health Information Systems and Technology Architecture. And we moved the DHCP or Vista system from an early architecture into a much more sophisticated architecture, and we took the applications and really started to build them in and revolutionize how healthcare was provided in the VA medical centers. We moved to a client-server architecture, off of the big mainframes into servers and the use of PC workstations instead of dumb terminals. We enhanced the wide area network and the local area networks, LANs and WANs, and we made them very high speed. We upgraded the architecture that the VA was using, and upgrading the technical infrastructure and architecture allowed us to also then greatly advance the applications, the business and clinical applications that we were using on the computer systems. It was during this time frame, because we were able to move to the use of PCs and the client-server architecture, that we were able to put in place the Windows operating system and start to use the computerized patient record system. All of the little standalone applications that were part of DHCP, the laboratory, pharmacy, surgery, medicine, clinic scheduling, patient registration modules, were all integrated and woven together, and the computerized patient record system came into being. And that was truly revolutionary. It was one of the first, if not the first, major deployment of electronic medical record systems in the world. And people came from everywhere to see what the VA was doing, and lots of manufacturers and software developers took what the VA had done and in turn built systems that are now being marketed across the country and around the world. Another major advance in the 1990s, aside from CPRS, was the introduction of the Vista clinical imaging system. Not only did we have all of this textual data with lab results and prescriptions and all of the key information that physicians needed, but we also added the clinical imaging capability. We were able to integrate X-rays and EKGs and all sorts of clinical imaging information into the computerized system, into the Vista system, greatly enhancing the capabilities of the system in terms of clinical uses. In addition, we acquired and deployed the decision support system, which is a management tool that was able to delve into and use all of the data generated by Vista. The medical care cost recovery system came into being. We introduced technologies like interactive voice response systems, hooking telephone technology into the Vista system so patients could start to dial into medical centers and over the phone check on their prescriptions and their next appointments and so on. It was an exciting time and lots of innovations occurring. Other things that started in the 1990s that bore fruit in the 21st century was the introduction of e-commerce. We moved onto the web. We put in place the first gateways into the internet, and we started designing for the first time applications for veterans, not just for employees. And we started exploring the use of wireless technologies and mobile workstations. In the area of telecommunications, one of the major events that occurred in the 1990s, which set the stage for a lot of the changes that were to occur in the 21st century, One of the projects was the Telecommunications Infrastructure Project, the TIP program. And that was a major investment made by the VA in upgrading all of the telecommunication infrastructure, wiring plants, cabling plants at all of the VA hospitals in the country, putting in place high-speed telecommunication links, tying together all of the VA hospitals, putting in multiple gateways into the internet so that the VA could start to interact and work with other organizations and let the veterans start to connect to the VA. What you're seeing on the slide right now in front of you is a picture of the computerized patient record system. This is just a quick image. At this point, I wanted to at least show that to you. For those of you who are working out in the field, you're very familiar with it. For those who are not part of the VA and have never seen the computerized patient record system, here's a typical screen where a physician can get on the system and look at patient data, in this instance laboratory data, and they can see the hard data, they can see graphical presentations of it, and they can also see clinical images. That gives you just sort of a quick look into what the Vista system is like.